There are many different things that increase a person's risk for blood clots, but pregnancy is actually one of those, and so is having a baby. A woman is at higher risk for blood clots during pregnancy and shortly after delivery, whether she's had them in the past or not. So you want to know if a blood clot can cause a problem during delivery, and actually it's the treatment for a blood clot that can cause problems with delivery. So if a woman has had a diagnosed blood clot during pregnancy, she'll be placed on blood thinners. This thins the blood. It actually reduces her body's ability to clot. And that's bad when you have a baby because we expect you to lose a certain amount of blood. And if you're on blood thinners, then you can lose a dangerous amount of blood at delivery. So that poses a problem because a lot of times we can't plan on delivery. Women just go into labor spontaneously. So towards the end of pregnancy, a doctor would prescribe a certain type of blood thinner that has a shorter half-life, meaning it doesn't last as long. And a plan is developed for induction and also for the woman to stop administering the blood thinner medication prior to delivery. Usually it's at least about 24 hours prior to her induction. Then we check the blood clotting time when the woman gets to the hospital and make sure everything's kind of returned to a normal state, and we proceed as usual if things are looking good. Shortly after delivery, the doctor will put the woman back on blood thinners because, again, a woman's risk of developing blood clots is higher after having a baby. We also take certain measures in the hospital. If you have an epidural, you're going to be bedridden and not moving around much. We put little things on your calves it basically is like giving you a little massage. They squeeze every few seconds to keep blood flowing through your legs to reduce the risk of blood clots. We encourage you to move around a lot. All of these things will help to reduce your risk in addition to medication, which you won't get during labor and shortly after delivery. Ultimately, the complications related to blood clots can be serious and even fatal. So if you've had one, be sure to follow up with your doctor, follow their treatment plan, and get checked out if you have any questions or concerns about how you're feeling, especially if you have unusual pain in your legs, behind your knees, in your calves, in your groin area, if you have difficulty breathing. Those are all reasons to go to the emergency room, especially if you've had a history of clotting problems. Good luck with everything, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.